prostate cancer as a disease of public health importance. Why did I title it that? It is known that prostate cancer does not affect women, it affects only men. But we usually say that prostate health is for men and for the women that love them. So this knowledge is not just important for men only, it is also important for women. So the next slide shows an overview of what I'll be talking about in this presentation today. First of all, I'll be going over the definition of the disease, prostate cancer. I will be talking about the etiology or causes of prostate cancer. I'll also give an overview of the epidemiology of prostate cancer. And in addition to that, we'll look at the clinical signs or symptoms of prostate cancer, things you can look at and point at and say, this person or I may likely have an issue with my prostate as a man. Also, we'll look at the diagnosis. How is prostate cancer diagnosed among men? And finally, we'll be looking at prevention, which is our focus in public health. We like to prevent disease. We don't want diseases to happen. So we're going to be looking at how we can prevent prostate cancer as men, or how we can advise our brothers, our uncles, our fathers on things to do to prevent prostate cancer. The prostate gland produces a fluid called the prostatic fluid. What is the importance of this fluid? This fluid serves to nourish the spermatozoa that is released during ejaculation by a male. So when a man ejaculates, the sperm comes out. Seminal fluid, 3 fluid is contained in the ejaculate of a man. For every ejaculate, there are 3 major fluid. One is the spermatozoa, second is the semen, and the third is the prostatic fluid. The spermatozoa is the living cell. It is microscopic, you can't see it. If you look at the ejaculate, you can't see the sperm cells that actually goes to fertilize the female egg, but the sperm cell is there. What we can mostly see is the semen that is produced by the seminal vesicle that helps to transport it. It makes it plaintive for it to come out. Also in that ejaculate is something called the prostatic fluid. What does the prostatic fluid do? That prostatic fluid is produced by the prostate, and it serves to nourish the sperm, the living cell in the ejaculate, the sperm. As the sperm leaves the body, the male body, into the female body, that prostatic fluid is what the sperm feeds on. It nourishes itself from the prostatic fluid as it leaves the male body into the female body. So that is the importance of the prostate gland. It produces that prostatic fluid that nourishes the sperm that is produced in every ejaculate by a male. Now, what is prostate cancer? Prostate cancer can now occur to that prostate gland. Basically, there are 3 diseases that affect the prostate gland. One is prostatitis. Prostatitis is simply infection of that prostate gland. So that prostate gland can be infected, sexually transmitted infection or different types of infection. That gland can be infected, and when it is infected, we call it prostatitis. The second disease that can affect the prostate gland is benign prostatic hyperplasia. That is a big word for enlarged prostate. So as the prostate gland begins to grow, we get to an age where it stops growing and it maintains its normal size. However, as some men grow older, the gland may begin to grow bigger than usual. When it grows bigger than usual, and that enlargement is not as a result of cancerous cells, we say it is enlarged prostate, benign prostatic hyperplasia, BPH. That is not cancerous. It's just growing out of size, but it is not cancerous. That is called BPH. But when the growth is caused by cancer cells, that is when we will now say a prostate cancer has occurred in the prostate gland. So when the prostate gland begins to grow out of control as a result of cancer cells, that is an occurrence of prostate cancer, and this is usually caused by DNA mutation. So when the DNA mutation means change, when the DNA begins to change and acting abnormally, and the prostate gland begins to grow abnormally as a result of cancer cells, we say prostate cancer has occurred in the prostate gland. Now, I added that prostate cancer that is detected early has the best chance for successful treatment. What does that mean? Prostate cancer can be cured. A lot of people say cancer cannot be cured. Cancer cannot be cured. Prostate cancer can be cured, but there's a caveat. It can be cured when it is diagnosed early. So when the prostate cancer is diagnosed early, it can be cured. However, if it is not diagnosed early, there are also some therapy that can be used to manage the prostate cancer, whereby a man with prostate cancer can live with it, manage it properly, and still live a normal life and still live a long life. So if you look at the image in the slide, on the left hand side of the image, you will see a normal prostate indicated in red below the bladder. If you see the thing above that red indication is the bladder, that is where the urine is stored, and there's a pipe passing through from the bladder in between the prostate gland. That is the urethra that takes the urine out of the bladder, out through the penis. Now, when the prostate has a disease, the prostate begins to enlarge. That pipe is made to shrink. The prostate will shrink that pipe, and urine will not be coming out well from the bladder anymore. So most of the indication of prostate cancer or prostate disease is urinary symptoms. So when a man begins to have urinary symptoms like difficulty in urinating frequently, incontinence, urinating on yourself, or forcing out urine to come out, it begins to show that there may be a problem with the prostate. The prostate may be shrinking that urethra and is not making the urine to come out. So the basic inclination or the basic signs and symptoms of prostate disease are urinary symptoms. When a man begins to have problem with urination, it may be an indication that there's something wrong with the prostate and you need to check, because the urethra passes in between the prostate gland. Now, if you look at the picture below, still on the left hand side, you'll see prostate cancer, where that prostate gland is beginning to grow out of proportion, begin to swell up, and causing a lot of trouble right there. On the right hand side of the picture, you will see something like T1, T2, T3, T4. In T1, T stands for tumor. In T1, the tumor is in the early stages. The cancer is still within the prostate. In T2, it is within the prostate, but it wants to come out, but it has not come out yet. In T3, so T1 and T2 is early stage of the prostate. Tumor 1, tumor 2, the prostate is early stage of prostate cancer. In T1 and T2, the prostate cancer is still, the cancer cells is still within the prostate. But from T3 and T4, it's advanced stage, late stage. The cancer is already coming out, it's spreading, it's metastasizing. Metastasize just simply means spread. It's spreading out of the prostate gland to other parts of the body, to the bones, to the liver and other parts, causing a lot of problem, not just to the prostate gland, but to other parts of the body also. So that is all about what the prostate is. So we've learned about what the prostate is, the different diseases that can affect the prostate, and how prostate cancer begins to develop in the prostate gland. So I'll be talking about the causes of prostate cancer at this stage. And in the slide, I said the etiology of prostate cancer is multifactorial. What that means is just that usually we cannot put our hands on what causes cancer. We cannot say this is what causes cancer, because this thing may cause cancer for individual A, but it may not cause cancer for individual B. So you cannot of a certain say this causes cancer. However, there are numerous modifiable and non-modifiable risk factors associated with the development of cancer. What is the meaning of risk factors? Risk factors are simply things that make you susceptible to a disease, things that predispose you, things that make it likely that if you give yourself to these things, or if you engage in these things, or if you have this thing, it may most likely cause this disease. So that is what risk factor is in simple, plain language. So when it comes to prostate cancer, we can really not say this is what causes it particularly. If you have this thing, you must have, that means it will lead to prostate cancer. No, we cannot say that. But there are some things that are risk factors, and they are non-modifiable and modifiable. What's the meaning of non-modifiable and modifiable? Like the word is, non-modifiable are things that you cannot, are risk factors that you cannot change, are things that you cannot modify. You cannot, for example, age is a non-modifiable risk factor. You cannot change your age. A 30-year-old man today cannot just wake up and say, I'm 10 years old. I decide that I want to be 10 years old. No, you cannot change your age. Also, you cannot change your race or your ethnicity. Those are things that you are born with, or you have that you cannot change. Those are non-modifiable, so you cannot modify them. But there are other things called modifiable risk factors. These are things you can change, behavioral, lifestyle things that you can adjust. So things like alcohol consumption, you can decide to stop alcohol consumption if you take alcohol. You can decide to stop smoking. You can decide to exercise more. Those are lifestyle factors that you can modify. So I believe we understand what non-modifiable and non-modifiable risk factors are. So back to the slide, I mentioned that there are some well-established modifiable risk factors, things you can change, and there are some well-established non-modifiable risk factors. What are those non-modifiable risk factors that predispose one to prostate cancer? First is age. So we have seen that as men grow older, they are more susceptible to prostate cancer. So an older man is more likely to have prostate cancer than a younger man. Then another risk factor is gender. Females cannot have prostate cancer. A woman does not have a prostate gland. And because a woman does not have a prostate gland, she cannot have a prostate cancer. All men have a prostate gland. And having a prostate gland predisposed is a risk factor that, because you have it, is most likely to develop if you engage in some of these modifiable risk factors. Another non-modifiable risk factor for prostate cancer is family history of the disease. So what that means is that if someone in the family, like if a man has prostate cancer, it is most likely that his son will also have prostate cancer. So from research, we've seen that family history of the disease, for men that have prostate cancer, we've seen that a majority of them, most of them, someone in the family must have had it before or may have had it before. So that now establishes a risk factor that if someone in the family has it, because we share, prostate cancer is a genetic disease. So it's a blood disease. And if someone you share that same blood with has it, is most likely that that gene may run in the family, just like in the case of breast cancer. So as I thought, I will try to use a correlation. As breast cancer is to women, prostate cancer is to men. So I will always use breast cancer as a correlation. So just permit me to do that. So, for example, in breast cancer, there's the BRCA1 gene and BRCA2 gene. So if a mother has that BRCA1 or BRCA2 gene, she's most likely going to pass it to her daughter. And a female that has that BRCA1 or BRCA2 gene may most likely have breast cancer also. So it is the BRCA1 gene is also a gene that predisposes men to prostate cancer. So we've even seen that if a man has prostate cancer, his daughter may likely have breast cancer, not because breast cancer and prostate cancer are related, but because that BRCA1 gene is involved in prostate cancer. It is also involved in breast cancer. But that's not what we're talking about. We're not talking about breast cancer today. But family history of prostate cancer is a risk factor. Once someone has it in the family, it's likely to run for the males in that. Once a male figure has it in the family, the males in that family are most likely. It is not certain. It is not by force. It is not a certainty they are going to have it. It's just a risk factor, likely going to happen, but it is more likely for those who have it in their family. Another non-modifiable risk factor is race. And what does race has to do with this? We are Africans, we are blacks, and there are other races like the whites, the Hispanics, and the Asians and all. But from research, we've seen that black men are more likely to have prostate cancer, and prostate cancer is more aggressive among black men. We don't know why, but part of the reason from research is that the black gene is more diverse, it's more complicated, it's more diverse than other genes. We can see that it's also affecting diseases like prostate cancer. That diverse gene, because our gene is more diverse, it is more likely to be more aggressive for black men. So the example is that if you have two men, one is a white man, one is a black man, and they both have prostate cancer on the same day, the progression of the prostate cancer in a black man is more faster. So the black man will get to stage 3 cancer faster than the white man. So that is a non-modifiable risk factor. You cannot change your race. If you are from African, if you have an African ancestry, you cannot change that because it is genetic, it's in your blood. Now, that's that for non-modifiable risk factors, things you cannot change. But there are now modifiable risk factors that predispose people to prostate cancer, things you can change. Those things are lifestyle factors like unhealthy use of alcohol, smoking, tobacco use, sedentary lifestyle, not exercising much. All those things can predispose. Also, diet. High fat diet can predispose one to prostate cancer. Also, environmental factors. For example, if a man works in an environment where they deal with some kind of chemicals, some insecticide, fertilizer, some of those chemicals are carcinogens. There are things called carcinogens, are things that lead to cancer. So when a man is in an environment that has those carcinogens, it can predispose the man to prostate cancer. However, these non-modifiable risk factors, you can avoid them. You can avoid these carcinogens. You can avoid high-fat diets. You can avoid red meat. You can avoid alcohol consumption, smoking, tobacco use, and all. So that is all about the causes of prostate cancer. The epidemiology of prostate cancer. Epidemiology just simply means the distribution and the burden of a disease. So if you look at the slide, you see that according to Globacom 2022, the magnitude of prostate cancer, Globacom estimated that there were 1,467,854 new cases of prostate cancer in 2022. This is just talking about new cases, over a million new cases of prostate cancer, and that caused over 397,000 deaths. So we have 397,430 estimated deaths of prostate cancer worldwide, according to Globacom 2022. So you can see that prostate cancer is a disease of public health importance, is a major disease of public health importance. In fact, in Nigeria, prostate cancer is the number one cause of cancer-related death among men. Prostate cancer is the number one cause of cancer-related death among men in Nigeria and in Africa. So prostate cancer is a disease of public health importance. And the at-risk population of prostate cancer is elderly men above 65 years of age. So among these men that have prostate cancer, we can see Globacom estimated over a million new cases in 2022. Among them, we see that a larger percentage of them are men that are 65 years and above. So older men are the at-risk population, and the burden is larger among men of African ancestry. Men of African ancestry die from this disease more than other races. So that's why I mentioned early screening and early detection next. Screening and early detection is very important. And because prostate cancer is more aggressive among blacks, it is advised that men of African ancestry go for screening from the age of 40. If you go online and read about this, for white men, they are advised to begin prostate screening from the age of 50. However, for black men, it is 10 years earlier. Start your screening 10 years earlier because your gene is different from that of a white man. So you can see the burden of this disease for an African man. We are advised to start screening for prostate cancer from the age of 40. And we'll talk about those screening as we go on in this presentation. Another thing under epidemiology is therapy. So prostate cancer, can it be treated? Yes, it can be treated. There are different therapy in managing prostate cancer, and the therapy depends on the stage of the cancer, if it is diagnosed early or if it is diagnosed late. One of the therapy or treatments for prostate cancer is hormonal therapy. Hormonal therapy simply means drugs, things that you take that goes into your blood. So when it comes to prostate cancer, there's something, the hormonal therapy that is used is androgen deprivation therapy. What is androgen deprivation therapy? What that simply means in layman terms is that when prostate cancer occurs, for it to continue to grow, it has to feed. Just like for anything to grow, it has to eat, right? What does the prostate cancer feed on? The prostate cancer feeds on testosterone. What produces testosterone in the male? It is the testis. So when a man has prostate cancer and we don't want it to grow, we deprive the prostate cancer of testosterone. And how do we do that? Through androgen deprivation therapy. So there are drugs that when a man with prostate cancer takes, it stops the prostate cancer, the prostate gland, from getting testosterone from the testes. Another way to do that is through surgery. So there are surgical therapies. Since it is the testis that produces the testosterone that the prostate cancer feeds on, and we don't want testosterone to be produced so that the prostate cancer don't keep growing, what we can do is just to remove the testis, and that is a surgery called orchidectomy. So for men with advanced prostate cancer, men with early stage prostate cancer is not necessary. There's another surgery done for men with early stage prostate cancer. It is called prostatectomy. Prostatectomy is simply, you have detected that there is cancer in the prostate gland, and the cancer has not spread. It is still within the prostate gland. What can we do? We just remove the prostate gland, just like it is done mastectomy in the case of breast cancer. When it is detected in, for example, one breast and it has not spread, what do? They quickly remove it so it doesn't spread. The same thing is done in prostate cancer. The prostate gland is removed in the early stage. When it gets to the late stage and it has spread to other parts, there's no point removing it. In fact, removing it can cause more harm in late stage of prostate cancer. So in late stage of prostate cancer, we do not want the cancer to continue to get testosterone. What we can do is just to remove the testis that produces the testosterone. And once the testis is removed, both testes, through orchidectomy, there's no more food for the prostate cancer to feed on. The growth will stop. But there's something called castration-resistant prostate cancer. Castration is like removal of the testes, right? So when the testes is removed, some prostate cancer are so aggressive that after a while they begin to grow again, but we're not going into that today. Other forms of therapy for prostate cancer is radiotherapy. And advanced prostate cancer, when it gets really bad, can be treated through chemotherapy. So prostate cancer is not a death sentence. There are a lot of therapies that can be used to manage it, and the man can live a good quality of life and live long with the disease. If you look at the next slide, also titled Epidemiology, it shows you the incidence and mortality of prostate cancer among different races. And the first bar chart there is non-Hispanic blacks. The green stands for incidence, that is new cases, and the red stands for mortality, that is death. And you can see that among non-Hispanic blacks, which are the African black men, you can see that the incidence rate is highest among black men, and the mortality rate is also highest among black men compared to other races. Now, the next slide is clinical signs. What are some of the signs and symptoms that when a man have, it can be pointing to prostate cancer? Like I mentioned earlier, the pipe that carries the urine from the bladder out through the penis passes through the prostate gland. And when the prostate gland enlarges because of cancer, it affects that pipe, it shrinks the pipe, and it does not allow a free flow of urine. So when men begin to have symptoms like frequent urination, it can be an indication of a problem with the prostate gland, because now that pipe has been shrinked and urine is not going out. So when a man goes to urinate, the bladder is full and the man feels pressed to urinate. He goes to urinate, but because the pipe has been shrinked, all the urine will not come out. So just a little will come out and he will urinate. He will finish urinating and go back. More urine will enter into the bladder again, and he will want to go and urinate again because he did not empty the other time. Instead of it to, if he had emptied, it will have taken time for the bladder to get full again before he will need to go and urinate. But because he didn't empty the other time, he didn't empty the bladder properly the first time, more urine will go into the bladder. He will need to go and urinate again. He will urinate more and go back, and that will lead to a cycle of frequent urination. Another sign, symptom of prostate cancer is weak or interrupted urine flow. When a man is urinating, when you're urinating, you're just supposed to urinate from beginning to end till you empty your bladder. But when a man starts urinating and in the process of urinating, it will stop and you have to start again. It will stop and you have to start again. To stop is an indication of problem with the prostate. Also, another major indication of prostate cancer is blood in the seminal fluid. So when a man ejaculates and there's blood in the ejaculate, it is a major sign of prostate cancer, not just problem with the prostate gland. When there is blood in the ejaculate, it is most likely prostate cancer. Another sign is the need to strain to empty the bladder. So when you have to force yourself, when you go to urinate and you have to push it to come out, you go to urinate as a man and it's not coming out, you have to push it and force it. That is another sign that there's problem with the prostate gland. Another major sign is blood in the urine. When there is blood in the urine is a major sign that points to prostate cancer almost directly. Blood in the urine is a major sign of prostate cancer. Also, pain or burning during urination. When a man is urinating and is feeling pain or burns, it might be an indication of an issue with the prostate gland. Also, there's something called nocturia. Nocturia is urination at night. When there is the urge to urinate frequently at night, is an indication of a problem with the prostate gland. For example, a man should not urinate more than once or twice at night. But once a man starts urinating 3, 4, 5 or more times, there's an indication that there's something wrong with the prostate gland. No matter how much water you drink before you sleep, you should not urinate more than once or twice at night. When it's becoming 3, 4, 5 times or more, then you should go to the hospital, see a professional. Another indication is erectile dysfunction. So prostate cancer can affect the erection of a man. Now, there are other signs like lower back pain and all those things point to prostate cancer. When a man begins to have lower back pain, it may be because the cancer is already spreading to the bones and is affecting the bones and the skeletal system, and the man may not even be able to walk if it is not managed early. So those are some clinical signs and symptoms of prostate cancer. Now I'll talk about how prostate cancer can be diagnosed. How will a man know that of a truth he has prostate cancer? The diagnosis of prostate cancer plays a fundamental role for clinical and patient care. The disease is curable when diagnosed in its early stages, but late diagnosis reduces the survival rate of the disease in an individual. Prostate cancer has traditionally been diagnosed through different measures. The first thing is digital rectal exam. What is digital rectal exam? DRE. Just like females do physical breast exam for themselves, digital rectal exam is done in the case of prostate cancer, but the difference is that for digital rectal exam, it can only be done by a healthcare professional. It can be done by someone that has been trained to carry it out. In digital rectal exam, the health professional or the doctor inserts his his lubricated index finger into the rectum, and by that he will be able to feel the prostate gland. By feeling the prostate gland, he can see some indications that will point that there are some issues with the prostate gland. Some of those issues, he may feel that it is too hard, it may be tender, it may be nodular, it may feel very enlarged. So that is the first physical examination that is done in the case of prostate cancer. But that does not tell us if a cancer exists or not. That just tells if the prostate gland is normal, is feeling normal, or is feeling abnormal. Now, when a health professional does the DRE and he feels like the prostate gland is feeling abnormal, he requests for another test. That test is called PSA test. PSA simply means prostate specific antigen. So a prostate specific antigen blood test is requested, and that prostate specific antigen is produced by the prostate gland into the blood. So when the blood is collected and it is seen that the prostate specific antigen is beyond the normal level, that indicates that the prostate gland is having some issues. There may be BPH or prostate cancer in the prostate gland. Now, the blood test also does not tell of a truth or for certain if it is cancerous. It just tells that, okay, the prostate gland is producing excess prostate specific antigen. There may be something wrong with the prostate. It may be enlarged prostate, it may be cancer. But to know of a certain if it is cancerous, another test is done. If we see that the PSA is high, we'll do another test, which is biopsy. In biopsy, a tissue, several tissues are collected from the prostate gland. So using a special needle, transrectal or transperineal, through the rectum or through the perineum, some tissues from the prostate gland is collected, just like cutting a little. It is also done in the case of breast cancer, cutting some small piece of the prostate gland to go and look at it under the microscope. Histology is done, and that histology will help us identify to see if there are cancer cells there already. So only through a biopsy would we be able to identify, to see through the biopsy, through the histology, we can see directly and for sure that cancer cells exist from this tissue that we have cut from the prostate gland. Now, by that, we can now diagnose that yes, this man has prostate cancer because we can see cancer cells from the tissues that we collected from his prostate gland. Now, when this is done, I also mentioned different stages: early stage and late stage. Stage 1, stage 2, early stage, stage 3, stage 4, late stage. How do we know? When we identify that there is cancer through histology from biopsy, how do we know that it is early diagnosis or late diagnosis? Another test is done. That is a scan, MRI, magnetic resonance imaging is done, and that will help us know if this cancer cell that we are seeing, if the prostate cancer is in its early stage or is in its late stage. So these are different steps. First of all, DRE will feel the prostate gland to know if it is normal or abnormal. If it's abnormal, we request for a PSA test to know if the prostate is producing excess prostate-specific antigen. If it is producing excess, we do a biopsy to let us identify if there are cancer cells there. If the biopsy and histology identifies cancer cells, then we do an MRI to know if it is in its early stage, so that we can know the kind of therapy to give, if it is early stage therapy or late stage therapy. The early stage diagnosis will also tell us, okay, at this stage we can remove the prostate gland and cure the person. Late stage, we'll know that, okay, we cannot remove the prostate gland. What do we do at this stage? Okay, we'll give some drugs, we do some removal of the testes if the patient agrees, or if the patient will need chemotherapy at that point. So that is how the diagnosis goes. So when a man goes for screening, also for frequent screening, yearly screening of prostate cancer, usually what they do is either a DRE or a PSA. So when they do a DRE, they just feel the prostate gland, just like the breast exam for females, and they can request for a PSA test. If the PSA is normal, then the man can go home. But if the PSA is too high, then they may need to do a biopsy to be sure if there is a cancer cell there or not. So that is all about the diagnosis and screening for prostate cancer. And we'll have an image there that you can just look at that shows the digital rectal exam. Finally, I'll be talking about prevention. So this is part I love. How do we prevent it? How do we stop prostate cancer? Like we said, there's no one particular thing that causes it, but there are some risk factors that can predispose one to prostate cancer. Now, what do we do in prevention of prostate cancer? We prevent ourselves from some of those risk factors. Some of the risk factors we can prevent ourselves from are like choosing healthy diets. So eat good food, healthy food, vegetables and all. Avoid unhealthy use of alcohol. Avoid smoking. Avoid tobacco use. Eat less of red meat and less high-fat diets. Avoid all that. Also, maintaining a healthy weight by avoiding sedentary lifestyle is also a very good thing. And maintaining a healthy weight by exercising, because obesity is also a risk factor, or obesity also predisposes men to prostate cancer. Also, another important risk factor or prevention, one thing to avoid, is to avoid multiple sexual partners. This is very tricky because from studies of prostate cancer, it has been seen that frequent ejaculation can reduce the chance of a man getting prostate cancer. So what that means is that if a man ejaculates frequently, he has less chance of getting prostate cancer. So it gives him a better chance of not getting it. However, a man can hear that, okay, if I ejaculate frequently, I may not have prostate cancer. It makes it more better for me to avoid prostate cancer. So let me just go and start having sex up and down so I can ejaculate frequently. No, there's a caveat to that. Although frequent ejaculation can reduce the chance of prostate cancer, multiple sexual partners can increase the chance of prostate cancer because multiple sexual partners can lead to infection. I mentioned prostatitis earlier, which is infection of the prostate gland. Now, when the prostate gland is infected, it can also predispose one to prostate cancer. So multiple sexual partners can predispose someone to infection, which can lead to prostatitis, and prostatitis can also predispose one to prostate cancer. So frequent ejaculation is good, but with a single partner, which should be your wife. So avoid multiple sexual partners is also one of the things to do. To avoiding multiple sexual partners is one of the things to do to prevent prostate cancer. Another wonderful thing which I would like to scream and scream and scream is early screening, early screening, early screening. Go for frequent screening. In this part of the world, we don't usually go for yearly screening or 6 monthly screening, but it's for males, like I've said earlier, for males from 40 years above as a black man, for those who have a family history of the disease, for those who are elderly, for those who someone in the family has had it before. It is good for black men also. Go for screening early and go for regular screening. At least once in a year, do a PSA test if you are 40 years and above as a black man. It is important. So just once in a year, a PSA test is not up to 10,000 naira. But 10,000 naira in a year, or even if it's 20,000 naira in a year, will not hurt. Just to be able to protect ourselves and prevent prostate cancer. Because when it is diagnosed early, it can be cured. And a man can have prostate cancer today and tomorrow he will not have it again, just because it was diagnosed early and managed properly. But even if it is not diagnosed early, it can be managed with several therapy and the man can still have a good quality of life and live long. So I hope we've been able to understand everything I've said in this presentation today. If you have any question, it is time to bring it up.